and welcome to the Wellness Made Easy podcast. Hey, I'm Larry Logsdon, and today we're revisiting a November 2023 discussion, managing joint pain, arthritis, and chronic pain naturally. I'm joined with Dr. Bob Martin, host of America's largest weekend health talk show, heard on over 500 radio stations. And if you're looking for safe, drug-free, stay with us for a simple steps to a healthier, pain-free life. Enjoy the broadcast.
Let's turn our attention to joints and pain. And if anybody that's listening to the sound of my voice right now has experienced stiffness of your joints, pain in your joints, or arthritis, or you just chronic pain somewhere else, this is going to be a topic that you should own. A topic that hopefully you'll come away from and say, you know what, at least I have something to do now rather than grind it out or continue taking these risky drugs that I'm taking right now, which I found out that actually add to the problem in the long run. Now, it's a good thing that we have pain-killing drugs because you get a tooth extraction or you fracture a bone from a fall or an accident, bring on the drugs or some other acute, exciting, interesting, experience that nobody wants to have. Bring on the drugs. That's what they're there for. But they're there for just short term, not long term. I want you to better know how to take care of yourself when it relates to joint stiffness, joint immobility, joint pain, arthritis, and pain in general. So we've invited a special guest to join us on the program to discuss it. His name is Larry Logsdon. He is a functional food researcher specializing in medicinal properties and benefits of exotic fruits and how human beings consuming these exotic fruits can help to parlay the ingredients and the constituents of these fruits to heal their bodies, to reduce the impedance to the healing process that may be going on. Now, Larry founded Tahiti Trader Noni Juice Company back in 1998, and I invited Larry to join us as a guest to discuss the topic of, and here's the topic, how to safely and effectively reduce joint pain and other chronic pain without risky drugs. And with that, let us welcome back to the program, Larry Logsdon. Good day to you, Larry.
Good morning, Dr. Bob. How are you this morning?
I'm doing well. How about yourself, sir?
Doing very well. It's a beautiful day here in Southern California.
Well, I'm glad you're able to roll out of bed and join us because there are a lot of people that are listening to the sound of our voices right now, Larry, who are challenged by, who are suffering with, or have some type of stiffness, some type of joint pain. They're in pain somewhere. And I've asked you to come on the program to discuss this topic. And I want to begin at the start of it, just like arthritis. Everybody knows the word, but and some people, think, well, yeah, my grandfather, my grandma have it, but I don't know if I have it. I hope I don't get it. Let's start with how many Americans, Larry, actually suffer from joint inflammation, otherwise known as arthritis?
Well, the numbers look like somewhere about 53 million people, are having some sort of arthritis pain. And there's a lot of varieties of arthritis. But basically, it has to do with stiffness in the joints and pain when you try to use them.
Mm-hmm. Yeah, on a regular basis. Once in a while. I mean, everybody's going to get joint, irritation from positional stress or whatever. But when it keeps going, that's when, over time, that's when I guess you could ultimately get the diagnosis. What is the most common form then? You said there's many kinds. What is the most common form of arthritis that Americans suffer from, Larry?
The number one is osteoarthritis. Number one.
Okay.
Then there's a lot of other varieties below there. There's so many others, but the one that people get the most is it's just damaged joints from, maybe weight gain or sports activities when they've gotten older, yet they really aren't in conditions, which has caused the joints a little damage, and they call it osteoarthritis.
Yeah, we call that as doctors just, wear and tear or degenerative joint disease. We like to get these fancy terms so we have insurance companies send us checks because they think we're smarter than they are. So since arthritis is often mistaken for other acute injuries, such as, somebody might strain themselves, or they might sprain themselves. How do people know the difference, though, between, do I have arthritis, or did I just strain myself moving incorrectly or being in a bad position? How do they really discern between the two?
It's a tough one to know, Bob. What you have oftentimes is just joint discomfort, and you think it might be arthritis because it comes and goes and comes and goes. Mm-hmm. But if it's really arthritis, it stays. It doesn't go away.
Yeah, that's more chronic than over time. It just seems like, okay, well, now I've got joint pain. It's not leaving my body. Is there a specific gender? Is it more common in males or females, joint pain or arthritis?
It seems as though the women are more affected by arthritis than men. Something like 2 or 3 times more women than men.
Wow, I'm reminded of that. That's pretty interesting. And especially probably the autoimmune type of arthritis, if I'm not mistaken, rheumatoid arthritis, right? Women more affected than males?
Yes.
Yeah, yes. That's what my clinical practice taught me. Why do some people suffer with arthritis? Some people complain of joint pain constantly in their 30s. Some in their 40s, 50s, or 60s. And then you have other people out playing pickleball in their 70s that just feel like they don't have joint pain. They don't have joint stiffness. They got full mobility in their 70s. So is it really age related?
Sometimes it is. The younger set oftentimes try to, keep their youth going, get out there to play basketball or, softball or something. And then they hurt themselves because they're doing things they did as a kid, but they're not a kid anymore. And that creates some damage. And that's the younger set. Then you have the middle set, which are the ones who've just sort of worn things out over time and they're really starting to feel their joints. And that's the middle set. And then there's this beautiful older set. I can't explain exactly why, but they seem to have their life in balance. They seem to have figured out what it takes to keep everything floating the way it needs to float. And they're out there in their 70s playing pickleball, playing golf, and doing all kind of fun stuff.
So it's not necessarily age related, because I can tell you from my own personal vantage point of treating 30,000 patients in my practice career that I had plenty of people who in their 40s had a ton of arthritis in their joints, spine, knees, elbows, etc. And then you have somebody come in that's 60, 70, and sometimes even 80, and they're still very mobile and still functional. And so I want people to come away from this conversation with realizing that just because you're 30 years of age or 40 now and you're feeling a little joint pain, you're not over the hill. And there is something you can do to help yourself out, short of taking risky drugs to shut down the pain symptomatology. We'll talk about that after this break. Stay with us. I'm Dr. Bob Martin. We'll get back to our special guest, functional food researcher and medicinal properties expert in the area of exotic fruits, Larry Logsdon. The topic is how to safely and effectively reduce joint pain and other chronic pain without using risky drugs. Now, you might say, well, yeah, but look, I'm in pain, and the only thing that I know about is to use over-the-counter or prescription drugs. But look, you've got to consider this, and it's not expressed enough, and we need to be reminded of the fact that these painkillers that are on the market today, they were never designed to be taken on a long-term basis. We know this. We know that acetaminophen, the active ingredient in Tylenol, is tied to blood cancers, and it's the 1 or 2 cause of liver failure and liver transplantation. We know that certain drugs, such as ibuprofen, as in Motrin, and naproxen, as in Aleve, and Celebrex, taking these doubles the risk of heart attacks and strokes, and can lead to a 40% higher risk of irregular heartbeats. We know this. It's fact. Look it up for yourself. We know that when you take aspirin, you can get an ulcer from it. It destroys your stomach over time if you take it regularly enough. And frequently enough, whether it's ibuprofen or stomach, ibuprofen is just a bigger aspirin. These nonsteroidal anti-inflammatory drugs, they may block the pain, but they're also destroying your cartilage at the very same time. And Larry Logsdon is with us as a special guest to explain all of that. And we're thankful that he's here because a lot of people are going to benefit by this conversation. All right, Larry, back to the conversation. Is it important or is it acceptable from every research angle you've looked at that people with joint pain or joint inflammation, that they stay active and they exercise even if they're hurting, or is there a cutoff point there?
Well, it seems, Dr. Bob, that most of the research shows us that keeping active is the name of the game. Keeping things moving and keeping the body doing what it does, even if it hurts a little, is the name of the game, because it makes the body do what it wants to do, and that's repair things. Mm-hmm. When you don't do anything, the repair process goes to a crawl, if not a stop, and there's your problem.
I see. Okay. Since most Americans, Larry, in a lifetime will view hundreds of thousands of commercials, drugs, the ones that I just mentioned moments ago on television, these television commercials suggesting that pharmaceutical drugs for the treatment of joint stiffness, joint pain, arthritis, of chronic pain, do you believe we are all convinced that drugs are all we have available to quell the discomfort of arthritis?
Well, Bob, it isn't, Dr. Bob, it's not the way it is. In reality, these drugs that have been developed have been come online in order to give some instant gratification, for lack of a better way to describe it, instant answers, so we get the pain under control fast. But the reality of all this is the body wants to heal itself, and if we'll give it the tools that it needs, it will do so, and you'll start to rebuild your own pain management system together with, if you're drinking Noni Juice, you're going to find out that it also helps control inflammation and the cytokines that are released that create the pain you're dealing with.
Yeah, and I want to circle back to that momentarily about how Noni Juice, drinking Noni Juice, has anything to do with reducing inflammation or reducing pain or helping with stiffness of joints and joint mobility. We'll circle back to that. But can you discuss 5 preventive or whatever number you can whip through quickly so that people that are listening to this conversation have something to grab onto with respect to preventive lifestyles that can help reduce the likelihood of developing arthritis, maybe on a preventive side?
Well, that's really a good, fun one, Dr. Bob. The first one I would say is keep your blood sugar under control. Mm-hmm. That means, don't let that get out of control. Stay off the sweets. Number 2 is start moving, exercise. Anything, everything. If you can get out a half an hour a day, you won't believe how much different you feel. Stretching plays a big role for helping your joints, so don't avoid that one. And avoid doing stupid stuff that might hurt you. That's kind of a crazy thing. I would also suggest eating fish at least twice a week. And if you're really, really thinking like I am, get on Noni Juice. That'll really help you.
Yeah, and speaking of that, you supplied to us something that before the show, a person by the name of Joe, I think it was is it Robinson?
Yes, it is.
Joe Robinson, who is a Noni Juice user who apparently had problems with pain and stiffness and arthritis himself. And I'm going to ask my producer to play that audio clip so people can get an idea of somebody who has used Tahiti Trader Noni Juice. Tahiti Trader Noni Juice. Listen to what Joe has to say. Alex, play Joe Robinson here. Go.
Hello. Well, hello. Is that Joe?
Yes, this is Joe.
Hi, Joe. It's Larry at Tahiti Trader Noni Juice. How you doing?
Well, I'm doing fine. Oh, yes, I've been using that Noni Juice for over 25 years at least.
So what brought you to drinking Noni Juice, Mr. Joe?
Well, I was having a lot of problems with, arthritis and low energy and, just, little nagging problems, physically. And it really helped. I've been taking it for about 25 years at least. Well, I was listening to some people talking about it on the radio one day, and I decided I would try it. I'm 80 years old now, and that's what's been keeping me going as far as I'm concerned. I'm still getting around well. I'm not in no chronic pain, and I feel good, and so that's why I keep taking it.
Were you having any troubles when you first started using it? Did things get better for you?
Yeah, absolutely. I felt better. I had more energy and all that. I feel good, and so that's why I keep taking it.
Wow. I mean, most people would be glad just to be not room temperature at 80, let alone not having arthritis at 80 years of age, Larry. That's pretty good.
It's amazing. We get lots of those kinds of calls over here at our office.
Well, let me give this out for people who are interested. They're going to be people who have arthritis, who have stiff joints, who have achy, breaky joints, have pain. Tahiti Trader Noni Juice. You can go to their website, TahitiTrader.com, TahitiTrader.com. You can also find Tahiti Trader Noni Juice in finer health food stores nationwide. GNC, Whole Foods, Natural Grocers, Sprouts Farmers Markets, TahitiTrader.com. We'll give the toll-free number out after this break. Stay with us. All right. Now, during the last segment there, we played for you an audio clip that, man, Larry, if I didn't know, I think you were an old radio guy. The way you were interviewing Joe there was great. Maybe you should get behind the mic over here. You did a great job at interviewing Joe there. But, there are going to be people listening, Larry, to this right now thinking, wait a minute. I've got arthritis. If my doctor knew, if my doctor believed that just drinking an exotic fruit juice that I've never heard of, never have I consumed it, called Noni, Tahiti Trader Noni Juice, if it was that good, wouldn't my doctor have told me about this? There are going to be people, Larry, listening to this conversation who are going to be a little suspicious, a little doubting about how a fruit juice such as Tahiti Trader Noni Juice can help with arthritis. Can you convince them? What can you say to convince them that it's for real?
Well, Dr. Bob, the reality of the whole thing is that it is not a drug, and therefore the doctors don't even know about it. That's the first thing. It's a natural food, been around 5,000 years. They overlook these things because they're not in the pharmacy that they prescribe from, and therefore it doesn't exist in their mind. First thing. But if you do a little bit of research, you're going to find out that, for instance, a very recent study at the University of Illinois found that drinking 1 to 3 ounces of noni juice a day would take care of a lot of inflammation problems that are associated with joint pain. They found it. It's not hard to find these things.
How long would it take? I mean, if somebody started drinking Tahiti Trader Noni Juice, like this study you're talking about at the University of Illinois, how long would it take before their joint stiffness or joint pain or loss of mobility would be noticed? Because Americans, we're geared towards, microwave ovens. If we can't turn it on, if it doesn't happen in 30 seconds, we're not interested. We move on.
Well, Dr. Bob, there's 2 schools of thought. If you'll give it at least 30 days to 60 days, you'll notice a difference, no question. But I've had people, do the noni juice, and all of a sudden, 3 or 4 days later, they're calling up saying, "Hey, you won't believe how unbelievable things have changed for me," because everybody's situation is a little bit different. The important thing about all of it is that your body wants to heal itself. Joint pain is not normal. It's not supposed to be there. Your body will take some time to repair itself if you give it what it needs. The first thing is get the inflammation under control. Mm-hmm. That's the first thing. And allow things to heal up, and you'll find you're feeling better pretty quick. I remember there was a time, Bob, might be years and years and years ago when we first went on the air together. We had a lady call up and had a very similar kind of experience. And she said that after 4 days or something, she had an immediate change. So it depends on the person.
Yeah, I'm gonna play. You know what? I have that still, and I wanted to play that in just a little bit. I will, but I want also people that are going to be coming in and out of this conversation to know how they can obtain or find Tahiti Trader Noni Juice. You can go to their website, folks, TahitiTrader.com, TahitiTrader.com, or just your health food store. Find your health food stores nationwide carry Tahiti Trader Noni Juice, including GNC. Vitamin Shop. Who else? You know the names, Larry.
Sprouts Farmers Market,
Natural Grocers,
Vitamin Cottage, and Natural Grocers, Whole Foods. You name it, we're there probably.
All right. And beyond this conversation, can they call your 800 number to ask questions or to direct them to a store close to them at 800-842-5309?
Yes.
Okay, very good. Now, you mentioned, and Alex, would you grab that audio clip of Anki? You just mentioned it, Larry, because this lady called into, that we're going to play for you, called into this radio show. I don't know how long ago, but she did, and with just unsolicited on the basis of laying down a stroker related to taking Tahiti Trader Noni Juice. Play the audio clip, Alex, of Anki. Go.
Good morning, Dr. Martin. You had a show on Noni Juice several weeks ago. I just was wondering if I could just share with you what I have experienced.
Oh, please do.
I've had lower back pain since 1982 from a car accident. Mm-hmm. And this past year, my back pain had become worse. I woke up every morning with severe back pain, and my whole body was sore. Well, I only took the Noni Juice for 3 days, and on the third day, my back and leg pain was completely gone. It's unbelievable. The juice was fantastic. If it wasn't for you, I would still be in pain.
Well, there's a stroker for you. Now, we're going to talk about the taste of Noni, what it tastes like. Are there any adverse side effects with drinking it when we come back from this break? So stay with us. You're tuned into the Dr. Bob Martin Show. The topic is how to safely and effectively reduce joint pain and other chronic pain without having to use risky pharmaceutical drugs, which have lots of potential adverse side effects. That's the topic. Our special guest, Larry Logsdon, a functional food researcher specializing in medicinal properties and benefits of exotic fruits. And the one we're keying in on is Noni Juice. And if you haven't had Noni Juice, you may not, you're missing out on the potential of helping with pain. Chronic pain, joint stiffness, loss of mobility. We've been talking about that now for, 45 minutes here on the show. Larry, let's lightning round from here on out. We just got a little bit of time left. And I said just before the break there, I wanted you to tell us about the taste of Noni Juice. What does it actually taste like for those people who have never had the opportunity to taste it?
Well, Dr. Bob, we have two formulas. We have our original high-potency Noni Juice blended with blueberry and raspberry. Delish. You're going to love it. And that's one I recommend people start with because, frankly, pure Noni Juice, which would be our island-style Noni Juice, is pretty strong stuff, Bob. You just don't want to...
Well, some people may want the strong stuff because they got strong pain with arthritis. They may go right to the therapeutic stuff. That's all good.
Oh, I recommend the therapeutic stuff for people who have real problems because you feel it sooner. And that's the name of the game, is get it working.
All right, TahitiTrader.com to find out more, learn more about Tahiti Trader Noni. Just TahitiTrader.com. And then, of course, find your health food stores nationwide, Whole Foods, GNC, Sprouts Farmers Markets, Vitamin Shop, Natural Grocers, or you can call the company directly for more information, 800-842-5309, 800-842-5309. Are there any adverse side effects, Larry, of taking Tahiti Trader Noni Juice? So some people, they say, well, I certainly don't want it to make my stool too loose, and I don't want to have a stomach ache. And are there any, can I take it if I'm taking other meds, any other drugs? Are there any adverse side effects?
Absolutely. There are no side effects. If you take it with your other meds and other supplements, you'll find they work better.
Okay, fantastic. Larry, thank you for your time and efforts here. This is going to help a lot of people out. Folks, TahitiTrader.com or Finer Health Food Stores nationwide, or call them at 800-842-5309. Larry Logsdon, have a good rest of the weekend, sir.
Thank you for listening to the Wellness Made Easy podcast. Be sure to follow us on social media for more health tips and visit TahitiTrader.com for your ways to support your wellness journey. See you next time. Thank you so much for listening.